They got just an overview of the study. They got the fecal matter from patients with fibromyalgia, implanted it into the germ-free mice, so they were completely clean, and those mice developed fibromyalgia symptoms. That's why it's so mysterious. You've got the IBS gut symptoms, you've got mood, depression, anxiety, fatigue, brain fog, sleep disturbance, and that classic naturopathic combination is really underlying it.
It's incredible. You need to get the gut right with nearly all conditions. And look,
yes,
dare I say all conditions, because
yes,
the microbiota plays such a significant role in all health conditions.
Hello, everyone. Welcome to Cura Conversations with Shannon and our guest, Brad Parkinson. Hey, Brad, how are you?
I'm good, Shannon. How are you?
Yeah, super well. It's been long overdue to do this, but today we're going to talk about that article from just last month, 2025, on fibromyalgia and the gut microbiome health. And
Excellent.
we're going to go over that and talk about how important, and just highlight, Brad and I are always talking about how important the microbiome health is. And this research paper really shows exactly that. So did you have a chance to read over it, Brad, just quickly?
Yeah, it was great. I had a look into it, and even though it's involving mice, human fecal microbial transplants into mice, it was fascinating. Really gave us some good insights.
Yeah, it sure was. And if you're out there watching this and you have fibromyalgia or you have chronic pain conditions, keep watching on this video. So fibromyalgia, it's predominantly women and affecting so many people in the population, and really mysterious. So back in the 80s, 90s, the medical profession really didn't even acknowledge it. People would complain of excessive pain and really tender spots, but the medical profession, unfortunately, didn't really acknowledge it. Fast forward to around about 10 years ago, the World Health Organization acknowledged it as a real condition. And those tender point pain areas are really key to it, fibromyalgia. But along with that, that's why it's so mysterious. You've got the IBS gut symptoms, you've got mood, depression, anxiety, fatigue, brain fog, sleep disturbance, and that classic naturopathic combination is really underlying it, because everything feeds into everything. If you're not sleeping, you're going to feel more pain. Yeah.
Mhm.
So, as you said, Brad, mice. So they got just an overview of the study. They got the fecal matter from patients with fibromyalgia, implanted it into the germ-free mice, so they were completely clean, and those mice developed fibromyalgia symptoms. So that's
That's
quite
correct.
clear evidence. Yeah.
Yeah, look, it was fascinating. They also had healthy controls that they
Mm.
did the same thing as well. And the healthy control mice versus the fibromyalgia mice, there was a clear difference in symptoms. The healthy controls were fine. And, it wasn't overall symptoms that you necessarily associate with fibromyalgia, but it was quite a lot, especially the hypersensitivity symptoms that we
Yes.
often see in visceral hypersensitivity in IBS patients and so forth. And definitely markers like immune markers, where cytokines and so forth. So a lot of those
Yes.
were changes. And this was only a 4-week period we're talking about too.
Yes.
So
Yes.
you wouldn't expect the long-term damage to intestinal cells and so forth, like that, intestinal permeability, necessarily to have occurred over only 4 weeks anyway. That's some of the things that didn't show up, but plenty of other symptoms showed up that are representative of fibromyalgia.
Yeah. And how do you ask a mouse its fibromyalgia pain score anyway?
Yeah. But what I found fascinating with the study is that there were so many things that they can test, and including like the microbiome testing that we use now, the genetic based metabolomic testing that we use
Yes.
was done as well, so they can see the specific changes in the microflora as it progressed over the 4 weeks. And yeah, incredible some of the things that they can gauge and measure. Back to your point about them not really treating fibromyalgia seriously over a decade ago.
Mm.
And now we've got these measurable, whether it's the immune system, the gut, hypersensitivities that can be measured now, and we certainly see these in fibromyalgia patients, and was clearly demonstrated in this study within the mice.
Yeah, it opens up another study, and it always brings many more questions. But rewinding right back to that naturopathic philosophy that we've really base our practice in, treating the whole, and everything starts in the gut and all of that. Fast forwarding, and now there's constant evidence just reinforcing what we do is correct.
Yeah.
There's so many questions, like today's society with sterilizing things with antimicrobial agents and additives to the food and chemicals and colors. And yeah, we're in a bit of a mess as society with the food that most people eat.
Yeah, certainly. And glyphosate is another problem in our foods.
Yes, yes.
What's getting sprayed on the foods before they even get packaged and sent our way. So there's also things like disinfectants,
Yes.
triclosan, other things that are just nasty stuff that shows up in our foods all the time that can have
Mm,
not only a detrimental effect on the microbiome, but some of these things that show up in our foods can cause cytotoxicity and it can be a real problem.
mm,
So
mm.
yeah, going back again, if you're not eating well, we obviously see the effects on the microbiome, but then this can play out in conditions exactly like fibromyalgia.
Yes, and then compounding as well. So those antibiotics together with the pesticides, together with the diet, together with poor sleep, and it just is so complex, and that's why it's mysterious. This fibromyalgia. One patient might be working on a farm with a lot of chemicals, whereas another one might be working in a mine site or an office with molds. It's
Mm,
always slight differences in that. And that's
yep.
when naturopathy is so good, because we're personalizing and really digging as a detective into your individual case. Yes.
Yeah, and I think it's important too that why we like the evidence base, um, a study like this coming through and it's evidence based, it gives us some really good, solid information to work with. The evidence based paradigm is kind of like this. It's about this scope
Yes.
of understanding of health versus you know traditional medicines and the historically what we know.
Yes.
Our naturopathic scope of understanding health and illness is much broader, and I think we can consider things coming in through the food supply and food chain, beyond just what is given to us through evidence based.
Yes. Yes. It's that a lot of those scientists will constantly push, we need more evidence. We need more evidence. And of course, we've this particular study, the implants with the mice, we do need more evidence. But is it ethical to give the fecal implant to healthy individuals and induce fibromyalgia? Obviously not. So it's a
Mm.
great start. But when is enough evidence? I mean, it's great to keep getting that. But as you say, we've got so much anecdotal evidence, history, combining foods and nutrition and herbs. Let's start with at least making the gut healthier. Making your gut healthier is not a bad thing. It's going to improve you. Even if it doesn't improve fibromyalgia, it's going to make you healthier. It's going to flow on to other areas. I was actually going to ask you, Brad, about in your practice, how many roughly percentage of your patients have a gut factor, not necessarily fibromyalgia, but all patients? How many roughly have that gut factor?
Yeah, I was looking at my cases last week, in the last week or two, and just to put some clarity on this, all but one had a microbiome test done,
Uh-huh.
and the only one that didn't had a mental health thing going on, and we were able to turn the corner in that case. So that particular patient is improving. So there was no
Mm.
need for testing at this stage, but that would have been a next step because we know how big a role the gut plays with mood disorders, for example. And some of these patients we're looking at, I know there's a psoriasis patient there's other skin issues. There was
Yes.
thyroiditis and a Sjogren's patient. So there's
Yes.
autoimmunity patients, all looking at gut stuff and I had microbiome tests. There's also, I could think of some of the others now, but there was a particular
Majority.
case I had that was syncope. So the patient was often fainting, and it was all to do with the vagus nerve and
Uh-huh.
gut symptoms, traveling overseas, like that post-infectious IBS picture was prominent in this individual, and it was a contributing factor to having fainting spells regular
Yes.
basis.
Yes.
So yeah, it's incredible. You need to get the gut right with it, with nearly all conditions. And look,
Yes.
dare I say all conditions, because the
Yes.
microbiota plays such a significant role in all health conditions.
Yes. And even if someone's watching this and they think for themselves about their condition, often even just IBS or bloating or constipation is little snippets of clues that the digestion is not right, then going right up to really swinging IBS or painful bloating when it's really obvious in your face that the gut needs work.
Mhm.
But yeah, almost all patients have some level of need for helping the gut, bringing
Yeah,
down the inflammation. Yeah.
and you raise interesting points there. I think there's obvious presentations with gut symptoms, like you just went through then, but I think a lot of individuals have a new normal. They get used to gut symptoms, have had them for so long that they don't think they've got gut symptoms. And I'm sure you see this in your clinical practice all the time, where we'll get individuals come in, they say, "Oh no, my gut's fine," and you sort of quiz them a little bit more.
Mm-mm.
And oh, I go to the toilet every second day, or sometimes every third day. And it's like, well, hang on a minute, and you find out more and more. And classic example of this is patients with skin health issues
Mm-hmm.
like eczema or any sort of dermatitis. Often we see constipation associated with that, and they often think that their bowel movements are fine and they're normal,
Mm-mm.
and they may not be suffering anything else. It just might be slow transit time, and there are other detox pathways, whether it's like the sweat or urination or anything else, that they might be a little bit compromised. The liver might be a little bit compromised, and the skin sort of takes over in that situation. So you've got to go back to getting that digestion right
Yes.
and that path of elimination correct, and then you see the skin conditions slowly but surely turn around.
Yes. Yes. It really highlights like a lot of those traditional, in a way, common sense things like chewing your food or taking the time out and not eating standing up, those naturopathic philosophies. But unfortunately, where we are in today's world, a lot of things become normal. Oh,
Mm,
diarrhea every day. Oh, it's just, I've always had it for years and years. And the stress levels being so high where it's the normal, which is quite
mm.
tragic, really, that we're just reminding patients sometimes, well, going to bed at 3 o'clock and only sleeping for 3 hours is not really normal. It's not going to pay off for your health, or eating that particular food, or and it just goes on and on of getting them out of that way of thinking and reminding them what is a good foundation for health.
Yep.
Yeah, let's talk about the fecal microbiome transplants, because in that study, which the link will be down in the description, they did that implant to the mice, but they also did it the opposite way to patients with fibromyalgia. So giving a healthy one to the patients with fibromyalgia and getting improvements. So in Australia, I know that there are a couple of places. So no doubt are aware of those as well. Do you want to
Yes,
shed
yeah.
any light on that?
Yeah. So yeah, in the study they um, gave the fibromyalgia mice some of the healthy control groups fecal matter, and then they turned those fibromyalgia mice around and got them healthy again. And yeah, there are clinics in Australia where these FMTs, fecal microbial transplants, are occurring.
Mm,
And I've had a few patients over the years, not many, go down that path.
mm,
And I don't know if they've been really successful. And they're generally targeted with, there's limited conditions you can use them for.
mm.
And the science, I don't know how evolved it's kind of, like I said, it was kind of more coming on and but really popular 5 to 10 years ago,
Yes, yes.
and
It
it
was
was
on
really
TV at one
developed.
point.
Yeah, and it's
Sorry to
really,
interrupt you in
no,
your
no,
train of
go
thought.
for it. But at this point of juncture, I don't know if it's come a long way to the point where we're seeing strong therapeutic uses for it
Yes,
at this stage.
yes.
And there could be various reasons for this too. Like, it's not even if you were to reproduce what was shown in the mice study we're talking about in humans, there's a lot more going on as far as diet and lifestyle
Yes,
factors
yes,
and all this. So, I think it's, even if you were to say, hey, that sounds like a great idea, maybe I can try that.
yes,
You've really got to consider making permanent changes to things like diet and lifestyle. And there might be other factors that are going on too. Like we talked a little bit about toxicity.
hmm,
You mentioned mold exposure and things like that. If you've still got these hindering factors,
hmm,
it may be just a matter of time before things go off a cliff again, and you're back
mm.
to square one.
Yeah, there's a lot of
So yeah.
relapse for sure. Yeah, I know there's the hospital, it's still in early stages, even though I remember 5 years or so ago being on TV and they're talking about the poo pill, and everybody said, oh, gross, which is a bit gross thinking about it, someone else's stool. But in the name of health, there's still ongoing research in Adelaide and New South Wales and Victoria, I believe, but a lot of relapse. I've had more patients than not getting relapse because if they don't change their stress levels or their diet or whatever the case. When you were talking, it also reminded me of just simple probiotic pills. You can't just take a probiotic pill and expect everything to turn around. It's much more than that. And we'll
Mhm.
keep going back to those multimodality factors of stress and diet and on and on, chemicals and toxicity.
Yeah.
Yeah.
And for fibromyalgia patients, it's such a challenge because there is that depression component and the IBS component and many other components and the pain management. And I often find with them, it can be a real daunting task to try and take on really big changes in lifestyle and diet and so
Mm,
forth. So they tend to need to rely on supplementation a lot, at least in the early stages. And we often see that does help, but it only takes them so far.
yes,
So
yes.
it's the trick is whether, I mean, we've been talking about FMTs, but uh, we can talk about supplements and as well. As good as they are at helping people and assisting people feeling better, that will not sustain better health without these lifestyle and dietary changes that will be needed. And
Yes.
again, uh, uh, there's that relationship with the microbiome that we see, having the right diet and right lifestyle to
Yes.
cultivate a good microbiome.
Yeah, it's a really, really important point there where you have to do it little by little, because sometimes the pain will worsen if they're throwing too much at it. And that's where our job is really to coach the patient along and hold their hand and guide them in the next direction while making them feel better and better each day along that journey, and targeting the next step in their journey. Also, we in that study, there was the reference to the specific Clostridium species, which was affecting the bile conversion. And that's highlighting, linking it back to the microbiome, where we get the report. And there's obviously not every known bacteria, parasite, or fungal species there, but it keeps growing and it keeps emerging with research. But knowing really with these tests what is going on and what are your levels of particular species, are they high or low? And I love that panel in the microbiome test where there's specific, because there's growing evidence on specific species like Klebsiella linked to autoimmunity. It's really exciting because you can see it on the patient's profile and address that. So yeah, in that study was more so the bile and the liver, and potentially the liver duct,
Mhm.
having issues with that, which is flowing on to those fibromyalgia symptoms. So really exciting research, and I'm sure you found it really fascinating too, Brad.
Absolutely.
Yeah. Yeah. So do you have anything final to add, Brad, with the fibromyalgia or microbiome or whatever the case?
Yeah, when you were going through it just then regarding the testing, it's, you know, it would be interesting to see if someone just went in, that they're a fibromyalgia patient and they just went in and had an FMT, and that's all they did, and then you compared that to some patients we get, and we do the comprehensive testing like a microbiome analysis. Now, the microbiome analysis also includes gut function markers, which is, I think, is very important, and they can
Yes,
be
yes.
even more important than what we get back as far as the microbiome analysis goes. And we would then target if there's pathogens, or like you said, Klebsiella or something,
Mm.
or there's a lack of Akkermansia or something like
Hmm.
that, and we might be working on building the gut. So we would be working on several levels, just based on those results alone from a microbiome test. You know,
Hmm.
we might be reducing the numbers of opportunistic bacteria and pathogens
Mm.
and
Mm.
increasing the beneficial flora. We might be working on healing the gut wall, which, you know, we generally look at healing initially
Mm.
when we take on a patient straight away, even though even
Mm.
if we have to get rid of pathogens, you're looking at
Hmm.
healing them. So you're looking at healing them, you're looking at modulating the gut flora, and
Mm.
then we'd be also looking at giving them dietary advice and giving them lifestyle advice, and doing all these things. And I think that's a stronger take on it. And the microbiome test would be one aspect, you
Most
know,
definitely. Yeah.
where we'd be doing extensive case taking as well,
Yes.
and that gives us a ton of information to work off too. Obviously, case history and so forth too. So, you know, I think the more encompassing approach that we would take, I think would fare better for patient outcomes than versus someone just getting an FMT, for example. Because
Most definitely.
like
Yes.
we said, if you just got the FMT and you didn't make any changes, I mean, you could be still being exposed to mold or something in your
Yes,
environment.
most
So,
definitely.
yeah, that's what I would add to what you were saying there.
It just reminded me of the pandas and the OCD in kids in the
Ah,
US.
yes.
Back, it must have been 15 years ago. The standard was to constantly treat the kids with antibiotics, just constantly, no end to it. And it was
Mm.
helping, but it wasn't addressing the correction of the microbiome. It was just simply cutting down the population of those opportunistic pathogenic bacteria. But it keeps evolving and we've got so much more to learn. But let's get back to those wonderful naturopathic philosophies, which help so many patients every day. And we hope we inspire you watching this video. Just please look into multimodality approaches and naturopathic medicine. Of course, we're very passionate about it being naturopaths. Yeah, so thank you, Brad. Thanks for coming on, and I look forward to the next one. And thank you for the viewer there. And if you want to keep on going, watch this video and keep on learning. Thank you.
Thanks, Shannon.